So my best friend told me the week that her mother died that she was grieving the loss of her mother for the second time. So this time that she was grieving the loss of her mother, she had lost her battle with Alzheimer's disease. But my friend had grieved the loss of her mother years before that. And that was the day that she realized that the disease had progressed to the point where her mother was no longer the same person that she once was. So how many of you have a personal connection to somebody with Alzheimer's or dementia? Okay. Alzheimer's and dementia is having a profound impact on our aging population, and it's just continuing to grow and continuing to get worse. And that's why I feel very passionately about trying to solve the problem and taking proactive measures to help keep people with Alzheimer's and dementia safe. So I'm Sharon Howard, and I'm the Victim Services Manager with the Sumter County Sheriff's Office. How many of you have victim advocates with your department? Okay, so if you have victim advocates with your sheriff's office, you're probably wondering why one is talking about Alzheimer's and dementia, maybe. But the reality is victim advocates are usually known for our resourcefulness. And so usually we're called upon because we know access, we know different resources in the community, we're aware of what's available to help people. That's who you call when somebody needs some kind of services, some kind of help. So oftentimes we get called for more than just responding to victims of crime. Mental health sometimes, homelessness, Alzheimer's and dementia. And so that's how I begun my journey with working with our community members that have Alzheimer's and dementia. We started having a big problem with wandering and missing persons with Alzheimer's and dementia. And so what we would do is we would follow up with families following the recovery of their loved one to try to link them with different supports. We would talk about ways to keep their family members safe and what they can do at their house to keep them safe, right? Locks or different technologies that will help them throughout, go through the journey of Alzheimer's. When I moved to Florida, I moved actually in the county next door to Citrus County, and that was where I started working for law enforcement-based victim advocacy. So if you haven't heard of Sumter County, Florida, who's heard of the Villages? Okay, all right. So 80% of the Villages is in Sumter County, Florida. So that's right, but it actually spans 3 counties in Florida. It's that big now. So who has not heard of the Villages? No? Okay. The Villages is known as Disney World for retirees, or I've also heard spring break for retirees. That's where many people, so as it started to grow, this has become the fastest growing retirement community in the United States, and currently is the largest retirement community in the United States. So fun fact for you, the Villages has more golf carts than New York City has taxis. Okay, they have their own roads for the golf carts. There's some pretty interesting golf carts. People decorate them and kind of, it's like a parade of golf carts, so it's pretty cool. So it's a very unique community. So as I mentioned, it's the fastest growing. It is between 2010 and 2020, it increased 39%. And the average age of our citizens is 72 years old. So why do I bring this up? Alzheimer's and dementia. So is a very big concern for our community, for our population. Because at what age does our chances start to increase for Alzheimer's and dementia? 65. So 1 in 9 people over the age of 65 have Alzheimer's and dementia. And the chance of developing Alzheimer's or dementia increases as somebody gets older. So with our average population being 72 years old, you can see that that's a problem that we're continuing to deal with. The map on the right kind of helps you visualize where it's a problem for you and maybe your state. As far as in 2020, the percent projected to increase, the cases that are projected to increase in Alzheimer's and dementia. The reason that these cases are increasing so fast is because of our baby boomer generation. So from 1946 to 1964 was our baby boom generation. They have started to turn 70 years old, okay? From 2016 up to 2035 is when this generation is going to start to turn 70 and be at more risk for Alzheimer's and dementia. So in my opinion, we're at the very beginning of this problem. As our population continues to age, I think they said by 2030, there'll be more people over the age of 65 than there will be children in the United States. So as our populations of our states begin to change and get older, the risk for Alzheimer's and dementia is going to increase. How this concerns law enforcement. How many people have dealt with missing persons for Alzheimer's and dementia? I think that's why you're here, right? So this is a huge safety concern. And like I mentioned, when I worked for Citrus County Sheriff's Office in 2017, we had a woman by the name of Carol Brown who lived by herself. Her children lived in the community close by, but she lived by herself. And she did what she did every day, go over to her neighbor's house for a cup of coffee, and she never came home. And we just passed the 5-year anniversary of her missing, and she's still never been found. So that kind of sparked for me the severity of this in our law enforcement communities and how dangerous it is when somebody goes missing. Also, if you get these calls for service, how many of you have gotten them and you get the call from dispatch and it's like, their loved one was last seen an hour ago, 2 hours ago? Because what do family members do? They try to look for their loved one first. Right? They exhaust all their resources. They engage the community. Hey, have you seen mom? Have you seen dad? Have you seen my husband? And they do their own search efforts before they call law enforcement. Why that's so dangerous is because now we're responding and we're at a disadvantage because now that individual has gotten 1 to 2 hours ahead of us. I was on the board of directors for the Alzheimer's Family Organization, which was in our community. And I'll never forget the executive director when her and I would meet and talk about this. And she said, Sharon, it's not a matter of if, it's when. And I think that is often overlooked by family members who are, on the journey of this disease with their loved ones because they think, oh, my husband would never do that. He's stuck to my side. My wife would never do that. She doesn't ever leave my side. So sometimes those behaviors change in a matter of a day. Sometimes they may just get confused. We have a lot of snowbirds in our area. And what happens is as the degenerative disease progresses, they might not recognize their house. They may go backwards to a house that they lived in when they lived in Massachusetts or Vermont or somewhere else. So that's the major concern for us, is that the longer somebody is missing, the more danger it poses for the individual and the harder it is for us, for law enforcement, to recover them. So the impact on our community, on our sheriff's office, we were averaging about 1 missing person call a week. And for a county of our size, that was a lot. We're not a huge county. Like I said, most of it is the villages. That was a lot for us. And I don't even think that we really felt the full extent of how often this was occurring, because the villages is a very unique community where all the neighbors look out for each other, right? So if you have a retired neighbor that's home a lot and they keep a lookout, they know, when you're not home, they keep a lookout on your house. So imagine a community full of people that are retired, are not working, and so they look out for each other. They know that they have family out of state, and so they look out for loved ones when the other one might not be home, or they look out for each other. And so very often when I was meeting these people that were coming in for this program that we developed, they would say, oh yeah, she's probably gone missing like once a week, and the neighbors would look after her. The neighbors would bring her home. So we don't even really know the full extent of how often somebody was wandering in our community because of that, and because of the nature of the villages, which is an amazing thing. It's an amazing part. A part of the community is they really look out for each other. Besides the villages, Sumter County has a very diverse geographic nature. Okay, so the villages is kind of the north end of the county. Prior to 1980, when the villages started developing, I think back then our population was about 24,000 people, and it was very rural, very farmland. So the south end of our county is still more rural and more farmland. What that poses is dangers when somebody is wandering, even that has Alzheimer's dementia, from the south end of our county. The real south end of our county, going into the next county down, is the Green Swamp Wilderness Preserve, okay? Not a good area, very dangerous for somebody who's wandering. We also have lakes, we all have a dense forest area, so the faster we find somebody, the more likely it is that we're gonna find them and they're not going to be injured or worse. So how do we solve this problem? Because there's a lot of efforts out there to address wandering. And so I have to say, for those of you who are in administrative positions at your sheriff's office, our sheriff, our chief deputy, our major were very much invested in this program, which really helped a lot. We had a lot of buy-in from our sheriff. And so they said, we want to find something that's going to help our community members in a way that it's never been done before. And when I really dove into our data for our missing person calls for service, I noticed kind of a disturbing trend. And that was that over half of them were missing, we were engaging in missing person calls, and they were in vehicles. Vehicles, driving, golf carts, as I mentioned, the golf carts. And so that's dangerous because most of the efforts that we had, our human scent preservation kit, were for people that were wandering on foot. Some of our search and rescue, our drones, our helicopters is really effective for people that are wandering on foot, but maybe not for somebody who's in a vehicle. And even some of our family members were saying, you know, I don't let them drive, but it's always a perfect storm. The first missing person call for service that I assisted the family with, the wife was devastated. She felt like it was her fault. She felt like she was to blame because she took the keys away from her husband, didn't let him drive, and it was a perfect storm, right? They come home from a doctor's appointment, the garage door is broken, she's anxious, she's a little bit frazzled, so she comes in and puts her purse on the counter. Well, people with Alzheimer's and dementia sometimes pick up on those anxieties, on that feedback they're getting from their caregiver, and so he became anxious. He took the keys off the counter, out of her purse, and got in the car and left. We found him 6 hours later driving the wrong way on a highway 1 county over. Thank God he had not been into a serious car accident or something worse. So we needed something that was going to address that problem. Because we could say very easily, don't let your loved one drive, but sometimes it's not on purpose, sometimes it's accidental. Sometimes family members are afraid to take the keys from somebody because you're taking away their independence. So we wanted to decrease missing person calls for service. We wanted to make sure that our families were able to find people faster, but how are we gonna pay for it, right? Isn't that everybody's question? So there is a grant out there from the federal government under BJA. It's now called the Kevin and Avante program, Reducing Injury and Death of Missing Individuals with Dementia and Developmental Disabilities. This grant opportunity lets law enforcement purchase locative technology to address wandering. And what's nice about this is that it also addresses wandering in people with developmental disabilities, autism that might also be prone to wandering behavior. So this was very helpful. So we applied for the grant, we got the grant. Now what do? We developed, we call it the DREAM program. So DREAM stands for Dementia, Recovery, Education, and Management. Why did we call it that? We recognized in our planning for this program that just giving somebody GPS technology, giving a family GPS technology was not going to solve their problem. There was a lot more that was involved to make this program a success. And so technology was probably our biggest part, and I'm going to talk a lot about that, but we also included training for law enforcement. We partnered with our Alzheimer's groups that provide services to caregivers to make sure that we were teaching, because many people think Alzheimer's and dementia is just a memory problem, right? that just, oh, grandma, grandpa, mom, dad is just a little bit forgetful. But sometimes what we don't realize is there's a lot more that's going on in somebody with Alzheimer's and dementia that affects their ability to think, to plan, all of our cognitive, executive functionings that's going on in our brain, because the brain is essentially shrinking. There's parts of the brain that are dying. It affects our visual acuity. So many times people with dementia develop like a tunnel vision and they see very limited what's in front of them. That's again why driving is sometimes an issue. And so we wanted to make sure that we were involving training for our law enforcement officers so that they understood the whole dynamic of this disease. And also that our caregivers have special needs too. Many times, especially in our community, the caregivers are just as the same age as the people with dementia and Alzheimer's. Many times they have medical concerns, mobility concerns, and so caregiving for somebody with Alzheimer's or dementia is a huge stress. There's a lot of things that they're worried about, again, themselves, but now caregiving for somebody that they love that is having, personality changes that they never had prior to. So we wanted to make sure we were offering family support too. For our technology, what was really important? What's the most important thing for technology? That it works, right? That it's going to be accurate, that it's going to find the person in the exact moment that there's an emergency. So accuracy was huge. We contacted many companies and had them send us samples, and my lieutenant would laugh if he was here because we would put them on him and he would ride his bike around the villages or he would go drive, and so we would call and say, where are you? We wanted to really test the technology to make sure that it was going to be accurate in the time that we needed it. So we narrowed down our devices that we were going to offer to 2 different devices. One of them is a wearable watch that looks like a smartwatch, and the other one is, it's called a GeoBit, and it's almost the size of a key fob. We knew that a wearable watch was maybe not an option or not the best fit for everybody, because we wanted to make sure when we talked to family members that we were making sure that it met their needs. If they told us that, hey, my husband will not wear anything on his wrist, right? He'll fidget with it, he'll try to take it off. That probably wouldn't be the best fit. We were also offering this to children with autism, so that might not be the best fit for them. So we wanted to make sure that we were able to meet the needs of anybody that wanted to come to our program for help. About 90% of our people chose the wearable watch, and that's because it does offer things that the GeoBit doesn't. So the GeoBit was a good fit for some, but the watch offered a lot of technology that one did not. And one of those things was two-way communication. So our caregivers can actually call the watch and it will automatically answer, because we know sometimes someone may be in a state where they're very confused and they can't maybe cognitively understand my watch is ringing, I need to press answer. So it automatically answers and connects the caregiver to that person immediately. I also learned a lot about technology that I didn't know prior to in this investigation. But some of our search, we would just go on Amazon and look up GPS watches, not knowing that there are certain certifications and certain things that make a technology superior to other technologies. So if you purchase, like they have ones on Amazon for like $30, but without a certain certification, I think, and it's called PTCRB certification, the network that the watch operates on for its location technology and for the two-way communication technology, if it's too busy, if there's too much going on in the airspace, it will kick those devices that don't have that certification off. So the watch actually has the same certifications for the airspace as your cell phones do, and it operates on an AT&T T-Mobile platform. So also, I know many of you may be thinking that someone's going to call the watch that is trying to sell them their car or tell them their car warranty is expired, right? How many of you get those calls on a daily basis? Or that they have to go buy a gift card because their niece or nephew is in jail. This watch blocks any other phone number from calling except the caregiver's phone. So that's the nice thing about that. Both companies worked with us because we felt, as I said, with some of our caregivers being also advanced age, we wanted to make sure that they were comfortable with the technology, and if they weren't, that we could still locate them. So both of them offered us a dashboard that we could access the location of all of the devices if we needed to. And we disclosed this to all of our participants. We felt that was really important because if we had a case where somebody was in a vehicle and they're driving down the interstate, the caregivers are not going to get in a vehicle and try to chase them down. So our dispatch can access these dashboards, and they will see the exact location of the device. And it even has a satellite view as well for some of our more densely populated or dense woods, or if we're in an area where there's forest and things like that. So very helpful for us to be able to see. We can also see battery life. When was the last time the location was updated? So if something did happen or the person was somewhere where there wasn't great service, what was the last time, the last known location, and when it was, where it was. Oh, I'm sorry. Did you want to see that? Okay. So like I said, a very large majority of our families do choose the wearable watch. It's not real obvious to what it is. I did bring that as well if you guys want to see it. If you want to pass it around, here you go. It's not, it looks kind of like a smart watch. So it's not very obvious that it's a GPS tracker. It also has a locking clasp, so the person cannot take it off themselves. And I think that's a big deal for a lot of families. And also, having it on your wrist is very helpful versus the GeoBit has to be attached to something, clothing, shoes, a belt loop, where this one is actually on the person. You don't have to worry about changing clothes, or some of our patients may take clothes off, remove certain clothes, jackets, shoes, may go out without shoes on. So that was a big concern for us as well. So we currently have 71 active. We've had over 100 devices distributed since December 2020, so for the last year and a half that we've run the program. And we really try to target, if we have a missing person call for service, we try to target that family and we offer it to them immediately after. But we also speak to local support groups and things like that to get awareness out about the program. So for you and your agencies, you know, I really implore you to see what the cost of the problem is for your distinct agency. How many search and rescues are you guys engaging with on a monthly, on a yearly basis? And what does it cost your agency? So the cost of the deputies that are responding, the cost of helicopters or drones, and the deployment of that, because if your agency is anything like mine, when somebody is missing with Alzheimer's or dementia, it's all hands on deck, right? And everybody is going out trying to look for that person. You know, there's if you're going to fund a program like this, there would have to be a kind of a cost-benefit analysis, but really the BJA grant is a great option, especially for you to see if the program is going to work for your community, because I think it's been 2 or 3 other times that the grant has come out and been available. So what were our results for our local community? I'm a stats person, but I'm also a very cautious stats person. So they look real good for our first year, which is amazing. And I really hope that that continues. So for the first year, for the first half of the year, what we do as part of this program is we track our missing person calls for service, but we also call every single one of our participants, and we ask them if they've used the watch in an emergency situation. And how we define an emergency situation for them is, would you have called law enforcement, right? Not like, I just want to see where my loved one is. I'm just curious to make sure they're still home. Like a time that you were like, oh my gosh, my husband, my wife is gone, and I don't know where they are. So we had 8 missing person calls for service, and this is when we just started the program, and 13 reports that they had used it in an emergency for the first half of the year. For the second half of the year, we saw that jump up quite a bit. We had 66 times that they reported that they used it in an emergency, and we only had 18 missing person calls for service. So we had reduced our missing person calls for service, we had cut it almost in half for the year of 2021, our first year of implementation of this program. Now, is that chance? I hope not. I hope we continue to see these calls reduced. And I do think that because of the way that we had looked back retrospectively and identified kind of our frequent wanderers and offered them the program, I do like to think that we did make a difference. We definitely prevented some incidents of our search and rescue and missing person calls for service. But perhaps a really great result that we had was, if you look at the bottom, we also asked the family how long it took them to locate their loved one. And they reported on average about 5 minutes, right? Sometimes they had wandered out of the house, or sometimes they had wandered somewhere when they were in a store. So they said about 5 minutes. When I looked at our response time and how long our deputies were on scene from when they started the search and rescue to when they located the person, our average time was 3 hours. And we had an average number of deputies per call for service of 7. So on average, we're saving a lot of time and a lot of anxiety on behalf of the caregiver that for those 3 hours is on a very heightened level of anxiety, is very scared for the well-being of their loved one. So I thought that was a really positive outcome, because not only are we making a difference for the families, but we're also hopefully saving money and resources on behalf of our agency. What I didn't expect to learn about this, because like I said, we wanted to, of course, have the numbers show that this program was effective. But what I didn't expect was the responses from our families. As I mentioned earlier, for caregivers, and for those of you who have a personal connection to somebody with Alzheimer's and dementia, for caregivers, keeping track of somebody with Alzheimer's or dementia, it's daunting sometimes. It's a lot on the family. And so we had caregivers that we would come in and they would be in tears, thanking us. Thank you so much for this. You have no idea the anxiety that this releases off of us. You have no idea. It's peace of mind. Over and over and over again, I heard peace of mind. And over the 100 people that we've had in this program, also what I've learned is you never have the same, the disease does not progress in the same way. I've met 100 people with Alzheimer's or dementia, and I've met 100 different people with Alzheimer's or dementia. Some of them have different, the disease is affecting them just in different ways. And so, but overall, the peace of mind that it brings to the family has just been huge. And that, for me, was by far the best result. We had one call for service where a gas station attendee called and they said, hey, there's a woman that's pacing around in the parking lot. I think she's lost. She can't tell me where she lives. I think she has Alzheimer's or dementia. And the husband got to the parking lot and got to the wife before our deputies even responded. So that was really cool. We've had multiple stories of people who, were able to not have to call law enforcement when their loved one was missing and were able to find them by themselves. And I think that was the best result, was giving family members the autonomy of being able, they didn't have to involve law enforcement. They don't have to make that call, to us that their loved one is missing. They have the power to locate their loved one without our involvement. Now, of course, we're still there to assist, to help if need be, but the power was in their hands. And many of them told us they were able to keep their loved one home. They had been considering memory care just because it was too much. So it might have extended the time that they were able to be at home with their loved one. So I'll share 2 quick stories with you.
Okay, hi, my name is Bill. I've been with the DREAM program now, I guess, about a year and a half. And it has been just a super program. We lived in a courtyard villa, and there was only one way in and one way out. So I thought, you know what, I'll set that fence up on the phone or on her watch and just allow her to get to the gate or outside the gate a little ways. And if she gets go further than that, my phone would ring. And so sure enough, I was in a board meeting one day and I had the phone on the table next to me and it rang. I looked down and I realized it was her number calling me. I excused myself and answered the phone and I said, Margaret, and she never responded. And I called her again, and a third time she finally says, where are you? And I realized now she realized she was speaking to me, and so we started carrying on a conversation. I asked her, you know, what are you doing? And she said, well, I'm walking the dogs. I said, honey, you're walking the dogs a little further than you normally do. And she said, yeah. I said, well, maybe the dogs are getting tired. Why don't you turn around and take them home? She said, oh, okay. And so she did. So I thought, oh my gosh, you know, what a wonderful device. I couldn't get over how the comfort it gave me to know that if something should happen more serious, that my phone was going to ring and I was going to be able to deal with it. It just gave me the satisfaction I just couldn't believe. And
my name is John Boaz, and I'm married to Vicki Boaz. We've been married for 56 years. And in the last couple of years, she's suffered from Alzheimer's pretty badly. I had an incident down at Brownwood where I was trying to park on an angle in front of the movie theater. And I waited for the car in the slot to back up so I could get in. So I couldn't move the car. Vicki was sitting beside of me, and she's a wanderer. So she opened the door, jumped out the car, and took off. As soon as the car backed out, I parked and immediately ran down the sidewalk trying to find Vicki. Unfortunately, she did not have on a TheraCare watch, so I couldn't tell where she was. By the time I got down to the corner where I thought she was, I went one direction. Unfortunately, she went the other direction. Took us 45 minutes to find her. We had community watch, we had the police department, and ultimately we found her and she was safe and very, very concerned about her safety. Well, the police department picked her up a couple times, brought her home, and the third time they said, hey, we have a program that has a tracking watch. I'll show you a picture of what that looks like. And the tracking watch is a very unique instrument in that it has a map that can be brought up on your cell phone so that wherever the person wearing the watch may go, you can see right on your cell phone where they are. So that was a tremendous help for me because she still wandered occasionally, but every time she went away, I could look at my cell phone and tell exactly where she was. It also has safety zones on it. This one's set for 350 feet. So anytime she went out of that safety zone, I'd get an alarm that would say, hey, John, you better keep track of what's going on. Now, it seems like it might be simple to keep track of a person who wanders. But when you're asleep at 2 o'clock in the morning and she wakes up and thinks it's 7 o'clock in the morning, she puts her clothes on, walks out the door, and goes down to the square. So you see the problem we're dealing with here. This watch eliminates the discomfort and alarm. Doesn't take away from the fear altogether, but it does give you something to do, how to find her. You can press a button on your telephone. It will contact the watch. My wife is beyond the place where she knows how to operate a watch. So it automatically rings her and calls back to me so she doesn't even have to answer the phone, and I can talk to her. Very, very important. Sometimes she's not able to talk because she's pretty advanced with the disease, but usually there are loved ones around in the community, sometimes a good police officer, sometimes a good citizen, and they see what's going on. They can talk to the watch. I can find out exactly how it's going. So all I can say is the support from the police department has been tremendous. The support from the watch itself, the corporation that provides the watch, think it's StoraCare. They're very good. A couple of times I've had to reprogram it. I just call them up, ask them what's going on. They tell me what button to push and it gets done. I have traveled with my wife, for example, to the store, and you have to watch them every minute. So I could be looking at the price of something. All of a sudden I turn around and where's Vicky? She's gone. And this has given me tremendous amount of comfort in that I always knew all I have to do is take my telephone out and I can tell her where she went. So it's like 1,000 pounds lifted off my shoulders when I got to watch.
I'm going to make one comment about the video and then I'm going to answer your question actually. So I think I also too forgot to mention that both devices have the ability to have safe zones that are set up, which is like an invisible perimeter around a home, or if the person goes to like a day program or something like that, so that the family member is alerted if any wandering does occur. And that's really been huge for many of them because as Mr. Boas, his wife was one of our frequent wanderers. He would be sitting in the house, in the living room and go to the bathroom and she would bolt out the door on a very recurrent basis. And so it was a big concern for him because he felt like he couldn't take his eyes off her for even a moment. So the safe zone alerts are a huge important feature because it sometimes alerts the caregiver that they're outside of that safety zone before they even realize it. Another thing about it is that it, again, what I mentioned, the autonomy and the independence. The first example, his wife liked to walk. And he had mobility issues where he didn't really join her on walks, couldn't join her as much on walks. So the safety zone kind of allowed her to walk and stay in that safe circle and alerted him. That was the example he was talking about, alerted him when she was outside of that area. So he brought up the price of both devices. So both devices have a purchase price and then a monthly, almost like a cell phone cost. The watch is about $30 a month. And the GeoBit's about $10 or $12 a month. So, any other questions? Yes?
Sure. What about like snowbirds? Like I have neighbors that go to the villages every winter.
Okay.
So, you know, they're down there, they get set up on this program, they come back in the summer months up to Wisconsin.
Okay.
Does that allow, I mean, if they wander up here, could we call you and say, hey, can
Yes.
you see where they're at?
So we tell people that these work anywhere in the United States. And beyond, I think anywhere in the world. So we tell people that obviously if you're in Sumter County and you call and say, hey, you know, my loved one wandered or I need help bringing them home, we know what you're talking about, we're able to assist. But if you're outside of Sumter County in another state or even in just another county in Florida, they might say, what are you talking about? I don't know that. So we give everybody the number to our emergency dispatch. We tell people, if you're out of county or out of state, tell the dispatch. Sumter County Sheriff's Office runs this program, and they can assist, and our dispatch will assist. Yes. You had a question, sir?
Yeah. What does the grant cover?
Everything. So the grant covers the purchase of the device and the monthly fee. We provide both devices to families free of charge. The watch is with a locking clasp,
That's when you set around?
Yes.
Pinch close?
Yep.
Okay.
So that's not one that locks with the pinch close. So on the locking clasp, it doesn't have those pinch, and it has a special key that opens up the watch. It's about $300 for the initial purchase, and with a locking clasp, which I feel like is essential. And then it's, like I said, about $30 a month. The GeoBit's up around $100 for the device.
How far out do you think is the reoccurring cost from this grant of being able to stand up this program?
So it was a 3-year grant, which was really nice for us to really see if the pattern, like I said, was just by chance or if we're really making a difference. So like I said, from the onset of the grant, because we started in the end of 2020, really 2021, January, I count that. So we're able to really run it for 3 years to get an idea of how much of an impact that it's making. And then it will be up to the decision, you know, do we use the devices that we have and foot the bill for the monthly cost? Or I've heard of some jurisdictions that had considered passing the monthly cost on to the families, right? So the sheriff's office is able to cover the initial cost of the device and then the families pay the monthly. So.
The watch has an SOS button on it?
Yes. I'm glad you brought that up. Thank you. So the SOS button, if it's pressed and held for about 3 or 4 seconds, it will ring the caregiver's phone. Yes. And so that's nice. And many of our families, I encourage them, go every time you put the watch on. Remember, if you need me, call, press and hold that button. And some that are not as advanced in the disease do remember that they can contact their loved one through that device.
So it rings their family member, not you.
Not the sheriff's office, yes. Yes. The watch lasts about a day. So every day we encourage families to charge it. And it depends sometimes on service. If there's real good cell signal in the house, many of our families tell them it's not completely dead after a day of wearing it. But I always talk to families about getting a routine, right? If they're with you in the morning, you watch the news and have breakfast together, throw it on the charger. It really only takes like an hour to fully charge it, because some of them too wander at night, so they wear it during the night. The GeoBit lasts a little bit longer because it doesn't have like the cell phone technology and things like that. So, and I think that one also can sense Wi-Fi, so it goes into like a sleep mode if it's at home.
Who's your vendor for this?
So for the GeoBit, the vendor for the watch is Clairvoyant Networks, and the watch is called TheoraCare. TheoraCare, TheoRacare.
So do y'all have like policy in place? Does the caregiver basically sign some sort of consent, since this is sort of like, for their privacy and all that?
Yes.
Allowing y'all to monitor their location?
Yes, we have what's called a participant agreement form that goes over that the program is voluntary, that if any time they don't want to participate any longer, they don't have to, and also that we acknowledges that we have access to their location, but that we don't routinely monitor it. And so many of them are completely fine with that. And any information that I have that you guys want, if you send me an email, I'm happy to share anything that I have, because I really do believe that this makes a difference.
So a family member that would have information on the location, of where the loved one is with a watch?
Yes.
It's all permission based, so like a neighbor, as long as they have permission, could jump on it as well, or?
So the app, so both,
Okay.
okay, yes.
Well, you're leveraging other people in the communities, right? I mean,
Yes, yeah. And they can have other caregivers on the app that have access to the location as well. So some of our participants have family out of state, and so they can have access to the location and monitor mom and dad as well, or grandma, whoever it is. Any other questions? Yes?
The whole DREAM program, is it housed under victim services, or are deputies involved?
So it's yes, so it's all victim services.
And you asked if it was a part of Health and Human Services?
No, I was seeing if like deputies were involved in it, or if it was
okay.
just.
Just civilian staff, yes. It could be, and again, this is even just from my perspective and our small county, easily a full-time job. Yeah, because I give out all the watches, and as I mentioned, like the family support is huge. So I sit down with the families when they're coming onto the program. We're not just like, here's your device, have a nice day. I set them up on the watch. I show them how to use the watch. I have parents that are older, and so I have a lot of patience with teaching them technology. And so I teach them, show them how to use it, make sure that they're comfortable with it. And also, as I mentioned, talk about support services. And I talk about other programs that we have, like our Human Scent Preservation Kit, that are also going to help prevent wandering as well, and kind of really tailor it to the specific needs of the family.
With the villages being the most predominant area that you concentrate on, my quick question on that is,
Sure.
like, let's just say kids with autism, that type of thing, is there kind of a crossover? Is it narrow in scope for?
So we have we offer it to everybody, but primarily the people that have taken us up on it have been with Alzheimer's and dementia population. We have 2 children with developmentally developmental disabilities that are on our program as well. Yes, we offer it. I mean, we would offer it to anybody. And we get with the schools. We've contacted with the schools so that if they have any children that elope, they will send them our way as well. It's just the demographics of where we live. We're the oldest population county in the United States. So there's that. All right, any other questions? Like I said, please feel free to call me, email me. I'm happy to share any information I have about the grant funding, about the devices or our program, or even like our policies and things like that that we developed around this. I'm happy to share it. Okay, well, thank you very much.